Thank you very much, everyone, for joining this podcast episode with Dr. Jarrad Van Zuydam. Let's dive in straight. Jarrad, you can welcome, first of all, and please introduce yourself in a long way so that whoever is 30 seconds late still hears your introduction.
Thank you. In a long way?
Yes.
How long? I'm sure we've got an hour, right?
Yes.
Yeah, my name is Jarrad Van Zuydam. Well done, you one of the few people who pronounced it correctly, but I suppose you're from Belgium, so the Dutch are just next door. I am the Chief Medical and Innovations Officer at Strove. Strove is a South African startup in the health and wellness space. We serve employers and insurers with a platform that encourages people to live healthier lives, essentially.
Great. You are a medical doctor?
Yep.
Right. And are you still practicing? Did you ever practice?
Yeah, I mean, my medical journey started in anesthesia, actually. I did a diploma in anesthesia and worked in a government hospital for a little while in an anesthetics department, and then did some private anesthesia as well before sort of getting more interested in sports medicine, sports and exercise medicine, and enrolled in a master's degree in sports medicine through the University of Pretoria. Yeah, I was gradually got going in sports medicine, and that led to private practice mostly, but also a career in cycling medicine, which was kind of my whole thing for about 9 years, where I worked as one of the doctors and eventually the head physician at Team MTN Quebec, who became Team Dimension Data. And then moved on to Team UAE Emirates, working at some of the biggest cycling races in the world. So people are always surprised to hear that the international cycling season is more than the Tour de France. So there were a whole bunch of other races as well, but did a few Tours de France. And then, yeah, after that, the traveling got a bit much, and that's when I sort of started with Strove. And that's been about 5 years now. And my clinical practice has shrunk as my involvement with Strove has kind of increased. So at the moment, I'm just doing 1 day a week in the theatre where we do some knee surgery, like sports medicine knee surgery, which is nice to keep contact with the clinical realm as well.
Thanks. I didn't know some of the things you just shared. But you don't just look after cyclists, you're also a cyclist yourself. I don't know how you combine it all, but how many hours a week do you spend on the bike, and how does being a cyclist yourself change the way you practice medicine in sports science?
Yeah, I mean, I think for me, balance has always been really important. Even through varsity, I was playing a lot of hockey. Hockey was my game sort of through high school and in varsity, and I was playing provincial hockey while studying medicine, captain the Wits first team as well. And so for me, it was always important to have some balance, and I then got sent out to the bush for my community service, which was a story in itself, but there was no AstroTurf out there, so hockey wasn't an option, and I bought a mountain bike just to cope with some of the stress and keep active. And the bug really bit hard from there. I mean, so it just cycling's become. I mean, I've probably ridden my bike just about every day since buying that mountain bike. So it's sort of snowballed from there, and it's become a really important part of my life. I'm not sure how I would kind of cope without that physical exercise and that sort of stress relief as well. And of course, the benefits for the rest of your life are, as we know, the benefits of exercise. And I think it's important to kind of practice what you preach as well. So I'm kind of trying to spread the message about, how important exercise is to your life, and it would be silly for me not to take advantage of my own advice. So yeah, more or less 10 to 12 hours a week. It depends. If I'm training for Epic, that goes up to 20 hours some weeks. So it really depends. But yeah, around 10 hours a week, most likely.
That's really very impressive. So you've already alluded to the idea that you practice what you preach. So let's talk a little bit more about Strove. So you said Strove is a health and wellness platform for corporate health and for insurers. Please explain more what it is, what it isn't, how it works. Some of the people on the call already know and probably are using Strove, but some might not know.
Yeah. So I suppose to go back to the beginning and how it kind of all began. I mean, while I was practicing sports medicine, I was also involved in a couple of executive wellness programs where companies would send some of their executives for their annual wellness check, and I'm sure a couple of listeners will have gone through the torture of those checks, sort of coming in for a full medical exam, an ECG, stress ECG, some blood tests, the whole thing. And the experience was frustrating for me because every year we see the same people, coming back from the same company and have a look at their markers, and invariably, the advice that you dispensed on the last visits had been ignored, and the patient was either worse off or pretty much at the same level, and these were people that often were pretty unhealthy and had a lot of risk factors. And so I felt that sort of the space between those appointments was really what we were missing. So they would come in once a year and then be expected to kind of go on their own and make all those changes over the course of the next year, which just wasn't realistic. And so when Chris, the founder of Strove, reached out, it really struck a chord, I suppose, and I saw this as an opportunity to be involved in that sort of in between. So really helping people engage with their health and well-being on a daily basis instead of only thinking about it once per year. And that's really the original idea of Strove, was a simple integration with Strava. You do some exercise, you get some points, and you swap those for a coffee voucher, and we had a couple other rewards partners as well. And it really just grew out from there. And we have listened to our customers in terms of what we've then built out. And so Strove has grown into a much more holistic offering now. So our roots are certainly in exercise, but the Strove platform now supports people with dietary change and helping them eat better, with sleep tracking and sleep education, sleep advice, and we've got a new sleep partner coming on board. So actually, people will be able to have sleep consultations. And then the mental health aspects as well, a lot of educational stuff, content, as well as the talk feature where people can actually engage with coaches and psychologists and counselors. So yeah, I mean, it's really grown into a holistic wellness offering. But the other side of that is obviously the part that you're interested in is the data that we collect from our users, and there's been a lot more interest in that side of it from insurer customers in particular. So I suppose that's it in a nutshell.
Great. So just to be clear, if I wanted to use the Strove app, I either need to join a medical aid scheme or an insurer that has a partnership with Strove, or I need to convince my employer, and then he can or she can sign. In this case, I'm my own employer, but a company can say, let's sign up as a company, and then all of the employees have access. Is that correct?
Yeah, so I mean, our model is kind of this B2B to C model. So we sell to other businesses, either employers and more recently insurers, and then they distribute the product to their members or to their employees. So we don't have a direct-to-consumer product just yet. It's something that we've toyed with. But yeah, that's kind of how it works at the moment, and it does make things harder for us. We have to kind of make that sale to the parent company, whoever that is. But then we still have to appeal to the end user so that they can actually use the product and discover the product and come on board as well. But yeah, that's how it works.
So you already said that the initial route was very much focused on physical activity and tracking that physical activity and gamifying it and incentivizing it. And now the Strove app, I played with it yesterday, is very holistic, very much seeing health as the complete version of I'm feeling good in my skin, I eat healthy, I sleep well, I look after myself, I move. And there's also a social component to it, because it's not just me, but it's me and my colleagues. So there's some social cohesion and healthy rivalry. And then also it's not just me and my app, but there's an opportunity to connect to third-party services and get more help, whether that's nutritional or whether that's career coaching. So it's really very all-encompassing, I would say, as a health initiative or as a health support tool, without ever having to make an appointment and go see somebody in an office somewhere.
Yeah, I mean, that's something that we've been very deliberate about and trying to make sure that we do cover all those different dimensions. I think there's a lot of kind of one-dimensional solutions out there, and some of them are fantastic at what they do. But what was coming back from our clients was that they were very happy with, for example, the challenges and the leaderboard and the exercise component, but they felt that their teams were struggling from a mental health point of view. And so it was clear that to satisfy all clients, we were going to have to, offer a much more holistic solution that can really cover all those pillars. And that's what we've worked towards over the last few years. And we kind of finally at the point where we feel that the offering is very well rounded and that there's something for everyone. I mean, not everyone is ready to take that first step on their journey to, a 5-kilometer, but they might be ready to start a meditation habit, or they might be ready to start, logging their meals every day to analyze their nutrition. And so we hope that the product meets each individual where they are in their kind of health and wellness journey. And yeah, as I say, that's really been something we've worked hard to get to.
Let's shift the conversation a little bit towards the data side. So the platform is used to give individuals all the tools and incentives needed to make healthy changes and really thrive, both personally and professionally. And in the process of doing that, you are becoming a big data collector and aggregator. You learn a lot about every single individual, day-to-day decisions they make, activities they do and don't do, and so on. Can you speak a little bit about how you make use of that data to the benefit of that individual, the individual Strove user, and also if that data benefits the one who's paying for the app, which is either the insurer or the employer?
Yeah. I mean, I suppose the big data side of it was really, something that we stumbled upon. It was never our intention when we started out. The mission of the company really is to help people be healthier, and that's really our fundamental underlying goal, and that hasn't changed. And so, when we started collecting data, all the data it became useful to help people on their journeys, in the motivation and gamification of health and wellness, of course. So sometimes just showing people, where they are and where they've come from can really make the difference between them actually, going out the next day and going for that walk, or calling it a day. So, progress tracking, enrolling in challenges, the social support, maybe competing on a leaderboard, whether that's a meditation leaderboard or a walking leaderboard or whatever it might be. And different people are obviously motivated by different types of data. But moving forward, the goal really is to hyper-personalize the Strove experience for each individual user. So as we start being able to build a picture of who each user really is, we can start delivering them the content that maybe they don't even know they need in the moment, and so the platform will start to feel more like their own, and each person's experience of the platform will be unique. So personalization is a big goal of ours for this year, and we've started working on a few little personalization features, and obviously, the data is vital there. In terms of our clients, so Strove obviously is a mobile app, and that's how users interact with the platform. But there's also a web app which is available to admin users from the organization. So that might be someone in HR, it might be leadership at an insurance company. That really serves as a data dashboard and allows the user to see aggregated and anonymized data in terms of what's going on in the organization. And that can dive down into, team level, kind of organization-wide. They can look at metrics concerning exercise and physical health. They can look at mental health statistics from surveys that we collect. And so there's a whole bunch of data that the client companies benefit from through being on Strove as well.
Yes, and so while we're on that topic, maybe it's a good opportunity to share a little bit about the limitations to that in terms of just so that no one gets anxious or worried. You're not just sharing every single detail of every single person with their employers or their insurers, right? So maybe you can explain a bit what you do and don't share and how that stays within the regulations and ethics.
Yeah, we're certainly not Facebook. So yeah, we're not in the habit of leaking or sharing data. And so yeah, all the data that is shared with us is private and confidential and can only be used in aggregated and fully anonymized form. So the employers and the insurers aren't able to dig into individual level and really look at sort of any one person, what they're doing. Even within Strove, as a user of Strove, you have privacy controls. So if you don't want your name to appear on the leaderboard or for anyone else to know you're on Strove, you can turn those features off and have that completely anonymous. Even our talk service, which is sort of a counseling and psychology and coaching service, those bookings are completely anonymous, and even to us, we can't de-anonymize those. So yes, we definitely take privacy and regulation seriously, and yeah, obviously the terms and conditions and all the legal stuff as well. That's the least fun part of my job for sure.
Okay, but very important because
Absolutely.
everything hinges on trust.
Yes, and that's something we realized from the beginning with the talk feature in particular, is that users were skeptical about booking a session because they thought that perhaps their HR leader would know that John has booked a counseling session, and always there's something going on with John, which of course is not what you want. And so yeah, we had to be very clear and put up notifications to assure people that the service was trustworthy. And yeah, I mean, we we've had thousands of appointments on that service, and that's going really well. Similarly, people might have concerns that there's an activity feed that comes up on the platform, and what if my boss sees that I went for a walk today, but there's a big deadline coming up, and they might say I'm being lazy, or so those concerns are real as well, and so we had to address those with the privacy controls and allowing people to sort of not appear on those feeds and leaderboards.
So thank you for that. Another aspect that we touched on in the days while we were preparing for this is often the full picture of the benefits and the effects of the Strove initiative are not fully visible through the app. And what I mean is, so let's say I start using the app, I am motivated, I move more, I sleep a little bit better, I make better choices in my eating. Those signals might be visible directly, but the indirect effects that probably matter more to my employer or to my insurer. I'm more motivated, I am more productive, I'm a more pleasant colleague to my colleagues. So there's a lot of things that happen that Strove isn't measuring, but they do still actually take place. There are positive effects that the employer might be able to measure, but you're not measuring it. Can you say something about opportunities for your clients to actually connect the dots and see how things that they are seeing on their side can be connected to things you have been measuring?
Yeah, I mean, that's of course the holy grail, and that's what our employer clients are really after, is that sort of proof of return on investments. And the promise really of platforms like Strove are that we can increase productivity through things like reducing absenteeism, presenteeism, that sort of thing. But productivity is notoriously hard to measure, and there's a bunch of attempts in the literature, but none of them are flawless either. It does appear to be the case that when people are fit and healthy and looking after themselves, they are generally more productive and present in the office more. For us to measure that productivity, we don't have that data, unfortunately. But what we do have is the ability to connect HR tech systems like payroll and others that a lot of these companies use through an API, and then connect that data with our data to see if there's correlations between wellness metrics and productivity metrics like absenteeism. So that's absolutely something we're working towards and excited about. So that's kind of in the early stages as well.
Okay, great. All right. Maybe we've spoken about the big data, all of them, the signals and all of the indicators that are being measured. Some of it is very objective. So my step count, it's difficult to consistently forge. I mean, who does that? You have to be a little bit psycho to do that. So that step count, if you use the app long enough, is probably a fairly good representation of your actual steps. Mental health is harder to objectively quantify, and there you rely on self-reported assessments. So my question is, can you say something about how users are scoring themselves? And then also, because you've been speaking to clients and to the users within these clients for a long time, maybe can you share a little bit of, let's call it anecdotal evidence, qualitative evidence of what people's experience has been?
Yeah, sure. So yeah, what you said about kind of the objective versus subjective definitely sparks something going back to my cycling medicine days. So when we're in, grand tours, these riders are riding their bikes for 21 days in a row, doing sort of 5-6 hours in the saddle some days, and really under extreme physiological stress. And we had all the numbers. We had daily, morning weights, urine osmolality, power output from the day before, heart rates, all sorts of data that we'd collect, enough to get you really excited, I'm sure. But very often, what was more powerful in terms of predicting where that rider was just going up to them at breakfast and saying, "Hey, how do you feel today? And how did you sleep last night? What's your motivation like for the stage today?" And of course, that data is subjective and very different to some of the other data we collected, but it was often more powerful. And I think when those two types of data are combined, you can perhaps get a more accurate idea of where that person is. And so I suppose the data we collect on Strove is quite similar. We get a bunch of objective, measured data through all the wearable integrations. So we can look at sleep duration, sleep quality. We can look at, daily steps, active minutes, all those fancy metrics, estimated VO2 max, etc. But the surveys that we ask users to do at least monthly, we use the WHO5, the WHO5 wellness score, which is just five quick questions. Gives us that kind of subjective measure as well, and a measure of wellness and mental health. So I suppose that can give you a more rounded picture of maybe how your team is doing or how members are doing. We do combine the data into a Strove score, which is something we released more recently. So that measures across 3 different pillars and then combines everything into kind of a score out of 100, which is an easier way for users to kind of digest that data and dig into it as well. So those are some ways we're making it easier for the user. In terms of data, I'm looking at a report. I mean, there's certainly a bunch of correlations that we've seen, with user behavior in terms of activity versus mental health scores and the correlations there. And it would be even more interesting to start getting correlations with some of the data that you mentioned previously, productivity data or data coming from employers or the insurers themselves. So yeah, I mean that's kind of where we are now.
Jarrad, the last minute or two, the connection dropped a bit. I don't know if it was on my side or your side, but would you mind repeating just the last 3 sentences or so?
I don't know what the last 3 sentences were, but no, I said we have started bringing all this data together and in the form of some internal reports and having a look at correlations between some of the objective and subjective measures. And there are clear correlations between people who engage with the app, are physically active, sleep well, and mental health scores. That's quite clear. What I was saying is it would be perhaps even more interesting to have a look at how those correlate to some of the data that we can't collect, that we mentioned with productivity, absenteeism, that sort of thing as well.
Okay, thank you. Then, to do justice to the title of this episode, we also do need to speak about AI. And nowadays, when we say AI, too many people immediately think we are talking about large language models that you can speak to or that you can talk to and type to.
Yeah.
But that's not all that AI is. AI is also machine learning, computer vision, neural networks. And some of these techniques, which are, let's call it old school AI, classic AI, may have more utility than turning everything into an AI-enabled chatbot. So can you say something about how and where Strove has or plans to integrate AI and what the added value of that would be?
Yeah. You sound like an AI skeptic there. But
Yeah. I'm
no, I
not
think
offended.
there's plenty examples of products trying to incorporate AI for the sake of incorporating AI. I think one that I saw recently was Strava. I mean, Strava is the biggest fitness app in the world. And they just, brought this digital coach feature, which is essentially an LLM comment on each workout that you do. But because that LLM doesn't have the greater context in terms of what your workout goal was, sort of what your I mean, just sort of what you're working towards, what you're training, what phase of your training plan you're in. The comments just felt generic and pretty useless, and they got lambasted on the Twitter or X and a bunch of other platforms just for sort of that pretty unuseful sort of application of AI. So I think we've been a little bit more cautious in that realm, and we think that when this technology does get introduced, it needs to be thoughtful and useful to the users. So the two main places where our users will have seen it is in the face scan feature, which is remote PPG technology. So similar to the technology that's calculating your pulse rates on your Garmin watch on your wrist. This is a camera that uses similar technology to estimate your resting heart rate and a couple of other metrics as well. And so that's been interesting. And then we use that data to build out some of the components of the health score as well. So that's a decent objective measure of where someone might be. And the other feature is a meal logging feature, which is just really cool. You take a pic of your meal, and it breaks it down into the core components of that meal, and we run that through our own algorithm and apply a scoring system that our head nutritionist devised, and it gives you sort of a rating of your meal out of 10, tells you kind of why that meal was good, why how it could be improved, and what you could do better next time. And you can kind of edit the ingredients if it does get it wrong and that sort of thing. And we're gradually iterating and improving on that feature as well. So those are kind of the user-facing AI features. But as you said, on the web app, that's where the technology becomes really useful for admin users and clients. So we are able then to surface signals from the data to give early warning systems. So, for instance, if a team, if their the average WHO5 score in a specific team has decreased by a certain percentage over a month, there's a flag that pings off and alerts the admin user, and then we'll give them some advice on things they might do to reverse that change. Moving forward, we'd like to be able to let those users then maybe enter their own data to allow us to pinpoint what might have caused that. So was it a change in leadership in that team? Was it was there a death in the team? There's all sorts of things that might be the cause for some of those flags. But yeah, early warning and being able to summarize, big data sets and break it down to kind of what's happening in which departments. I think that's really what we're going for on the web app side.
Okay, great. So one common theme throughout the last half hour is that you're never really done. You keep on developing, keep on improving, keep on extending as new technologies like the face scan become available. So I sense a very dynamic, innovative, pioneering approach where you have accepted that the Strove app, there's never a final version or a we're done here type of a approach. Is that correct?
Yeah, I mean, our engineers are pulling their hair out every time Chris or I comes up with a new idea. But I suppose it's one of the hardest things to learn in the sort of startup space is kind of when to say no and when not to chase the next shiny thing. So it's very difficult, especially if it's coming from a client and someone's asking for a specific feature. You really have to take your time on that decision, step back, and decide how many users and clients is this really going to affect? Is it going to maybe dilute the strength of the platform? Otherwise, I mean, there's so many things to think about before diving in and building something. But absolutely, I mean, the platform has evolved very, very quickly. I mean, our guys are releasing new versions on a weekly basis. And yeah, there's still a backlog that's going to take us 5 years to get through. So yeah, it's exciting to be in that space and as you say, trying to innovate and push the margins as much as we can.
Great. On the topic of 5 years, so when health is is an infinite game. You're never done. Just like you're never done building the app, you're never done working on your health and working on your quality of life.
Yeah.
And certain things have an instant effect. If you go for a walk, your mental health will probably peak quite quickly during and after the walk. But other things like eating healthier and sleeping better, the effects accumulate over months and years. And that also then means that if you want to prove that it works, you need to brace yourself for a long time of data collection. So where I'm going with this is, if now that you've been running for a few years and hopefully many more to come, what are the kind of long-term proofs of value, proofs of impact that you are looking forward to or planning for that necessitates these longer-term observational data tracks?
Yeah, I think you must have read my article in the app. Then there's an article called "Exercise in an Infinite Game" that I wrote a couple of years ago. It's in the Strove app in the learning portal. And absolutely, that's definitely how we view it. And what goes along with that is consistency. And so, not necessarily being the hero and going out every weekend and doing a 300-kilometer ride, and then not exercising for the next 3 months. It's really about small daily changes that you can make that turn into habits, and then you gradually sort of build on those. So that's definitely what we've preached, from the beginning. Yeah, I mean, going forward, we've got to the point now where our data set is large enough to start, drawing some conclusions, which has been quite exciting, and we've built a bunch of internal dashboards and reports that are promising. But where we'd like to get to is to be able to start showing these to the world as well, and moving the whole industry forward and contributing to the industry as well. So that's definitely a goal of ours, and obviously being able to use that data to self-improve and get the Strove platform to be as good as it possibly can be.
Okay, that's very encouraging. So what you said reminds me of something I noticed when I was a medical student. At some point, we were asked to do a literature review of interventions that were very much focused on sports science. And I'm not sure if if you would agree, and if you don't, please explain to me why I'm wrong. But something that I seem to pick up is that a lot of these studies in sports science and in physiotherapy have extremely, for my subjective perception at least, small sample sizes. It was 20 runners do this and 20 runners do something else. In medicine, in sort of classic medicine, not sports medicine, usually it's hundreds, if not thousands, of people that are randomized in different arms of a study, not a handful or two handfuls. And so two things. One is that only makes sense. These small sample sizes that I saw, I don't know if that's still the case, only makes sense if you expect extremely big effects. Then you don't need hundreds of people. Then a handful of people. Yes. So if the signal is huge and the noise is comparatively small, then I get it. But I think so that's, I would love your comment on that. But also now taking it back to Strove, you said the platform has grown a lot. So that means you are now in a position to not just answer the unsubtle questions, but also start answering much more subtle questions for which you need big data. And so you can, because in statistics, the generic type of question is, on average, is this bigger than that? Or on average, what's the effect? And when I was studying statistics, I would get annoyed with this on average thing. Everything was always on average. And as doctors, we know that no patient is the average patient. And so if you say to your patient, on average, I expect you to lose 100 grams a week or a month or whatever, then it's normal that they would say, but okay, that's the expectation. Is it 50? Is it 150? What's the range? And so, and what does it depend on? Maybe if I'm taller, I should expect a slower decrease, or if I am older. So what are the effects of the other covariates? So I think that you beginning to be in the realm where you can ask these subsequent questions and build more nuance into the insights and the analysis.
Yeah, I mean, as you say, it's not just sports science. I think nutrition is similar in that when you're doing interventional studies, placebo-controlled studies, it's the practicalities of it make it quite difficult. I mean, putting a lot of the time, exercise studies might involve a exercise to exhaustion or a VO2 max test or something, which is obviously expensive, time consuming, and it's going to be difficult to do. And 500 users. Nutrition is similar. That they're very difficult to control and get people to actually stick to a specific diet or calorie count or whatever it's going to be. But I suppose what you're speaking to is the potential power of platforms like Strove, and can they kind of be the research platforms of the future? If the data is validated and accurate, can you use that data to really get the power you need to look at some of these smaller order effects? So I mean, I mentioned VO2 max in a lot of the sports science studies, and nowadays wearables give you a semi-decent estimation of VO2 max, and you can really have that at scale. And then by kind of applying an intervention in two different groups, are you able to look at that number and get to something which you can draw conclusions from, which is obviously exciting. And there's a lot of ifs in that dream as well. But I think we are starting to see some of that. I mean, companies like Whoop are publishing, and there's a couple of things that they've published that I don't like, but the trend is quite clear, and that's really becoming a thing, and wearables are starting to be taken more seriously than what they were before.
I'm going to quickly interject by inviting our audience to type questions. So there's a Q&A feature within this Teams call that you can use to write a question. If you prefer to use the chat channel, that's also fine if for some reason the Q&A doesn't work. But so while we continue, we've got 15 minutes left. If anybody has questions for Jarrad or for me, please go ahead. And then while we do that, one feature of the Strove app we haven't spoken about yet. So you already alluded to the coffees that you can earn if you earn points, but users can also use their points to plant trees. And to me, that's an intriguing idea in the sense that it's sort of, I mean, it speaks to you really thinking out of the box and holistically, because one in the sense of one health and planetary health, a healthy environment contributes to human health as well indirectly. I also think that there probably is a correlation between people who care about the environment and people who look after their bodies and their mental health. But can you speak a little bit more about exactly what this initiative about planting trees is, and how is it going? What's been the effect and the uptake?
Yeah, it's I actually haven't spent a single one of my Strove coins on anything else except trees so far, because it's just cool. And I think people are motivated by different things. For some people, you know, getting a free coffee every week is great, and you know, I love my coffee too. But I think for others, the ability to, you know, maybe plant a tree that's going to you know, grow over the next 50 to 100 years and contribute to the environment is more motivating, you know. And so we did this through an integration with a company called Ecology, and that's kind of what they do. So they run projects all over the world, reforestation projects all over the world, as well as carbon sequestration projects. And you can then, you know, use your coins in the Strove app to plant trees, essentially. So you can plant one tree at a time, or you can save up and plant 50 trees at a time. So that's what I do. I kind of save them up and then plant 50 trees at a time. And then you can actually see your little tree in the forest, and you can click on it and see where it is in the world. And it's all audited, and I think it's a very motivating feature. So yeah, we recently crossed 10,000 trees. We made a post the other day about 10,000 trees. We're maybe closer to 11,000 now. And that's there's also a whole bunch of carbon sequestration that have happened there as well, as you can choose between the carbon or the trees. So yeah, we're quite proud of that one, and it's a cool reward mechanism, I think.
So it will be a full circle moment when somebody posts their steps that they've taken in the forest that somebody else planted sometime before that.
Someone can go for a run in the forest that we planted. Yes. Yeah, absolutely.
Yeah, no, that's really awesome. So I invited people for questions. So far, it seems like there's some people are shy. Let's see. There's one comment. Okay. So Margot asked, I see you operate across multiple countries. How have you customized your interventions and advised for different cultures?
I suppose the markets we serve largely are kind of in the West. I mean, we've got still our greatest presence is in South Africa. And then we've got clients in the UK, the US, sort of smattering through Europe, and more recently in Australia, and then up through the rest of Africa. You know, companies often based in South Africa have employees sort of up through Africa. So we do have a global presence. The main way in which the platform is different in different countries is through the rewards that are on offer. So we have to offer, you know, rewards that are redeemable in the local environment. So that's a tricky one to get right. But we've managed to do that, and so, you know, all those countries will have, you know, different rewards experiences. But the main app and the functionality of the app is the same.
Okay. Maybe while we wait for more questions, I can go next. So the rewards speak to the gamification and creating incentives for people to keep making the right healthy choices. And when you are making a lot of bad choices, then initially it's fun and it's exciting and it boosts your self-image when you look back and say, oh, this week I made better decisions. I ate healthier, I slept better. That's great. But there's the challenge, one of the challenges, and I'm also speaking from personal experience, is that you can't keep improving. At some point, you're going to either hit a ceiling or you're actually going to regress. And a lot of the apps that I've used in the past aren't ready for that. They naively think that you can only get better and better and better. And so inevitably there's going to be this hitting a wall and dealing with failure or dealing with falling off the tracks and regressing. So what would you say? How has Strove prepared users for relapsing or for losing interest temporarily? Is there a way to kind of rope them back in? And as you say, see it in an infinite game rather than a short-term game.
Yeah, I think when I think of sort of people's health and wellness journeys, it's quite similar to the way someone would improve fitness. I'm sure you've seen the graph. It's a sort of a squiggly line that goes up and to the right. So essentially what happens is that you stress yourself through training, and immediately after that there's a period of kind of you're actually worse off because you're tired and your body takes time to recover from that training session, but then it super compensates and you take a 2 steps forward, and then you stress your body again, and that takes you 1 step backwards, you recover, and that's how you improve. And that's very similar to the way I think most people will experience a wellness or a health journey. That there's certainly going to be ups and downs and obstacles in the way, and I think what you said is spot on. In terms of the gamification, we need to make sure that any gamification is not discouraging and doesn't punish you for kind of taking a rest week or having a tough month and not engaging with the platform. So there's no mechanism to punish users, but there are a bunch of ways that we try and re-engage users regularly, and that's often through campaigns that we launch with specific themes every month. And so it might be a mental health theme coming up, there might be a nutrition theme the following month, there might be a fitness theme the next one, and so you can kind of pick it up again wherever you want and re-engage into one of the in-app challenges and get going again. So there's certainly no punishment, and we absolutely realize that no one's perfect and just sort of continues to improve infinitely.
Thank you. And okay, we've got another comment here. Okay, I was going to say the fact that you have such a holistic approach, multi-pronged approach to improving wellness and health also helps. So if you're falling off the ladder in terms of activity, maybe this is a good opportunity to focus on sleep or focus on nutrition. So it's not an all or nothing.
Absolutely.
experience.
It's quite seasonal as well. So that's something that the data is very clear on. When we have a look at our own data, is that things often peak in the spring months. So people are motivated. The first blossoms appear, and people are thinking about hitting the beach maybe in December, and motivation is high and engagement is quite high. Unfortunately, during December, that often wanes just because people are on holiday, they may be less focused on their goals, and then it picks up again sort of towards the end of Jan, and that's just it's kind of seasonal, and things ebb and flow.
We have another question, and the question is, are you planning to leverage the platform to offer additional health risk screening and target health behavior change solutions?
Yeah, so I mean, we still in the, I suppose, preventive health and habit formation sort of game, but we have more recently started moving towards more active preventive health and thinking about screening and incorporating a bunch of other preventive health features. There's certainly a need for it in the market, and something that obviously the insurers are also looking for. It's just pretty important to kind of stay in our lane and do the things that we prove we can do and that we're good at. So what we do have coming pretty soon are pathways, which are kind of micro learning experiences within the app that are based on certain themes. So you may have a journey that focuses on healthy eating for weight loss, for instance, and that might be an 8 to 10 week guided content experience with videos, audio, as well as reading to do on a topic, with a couple of little assessments here and there. And so that's one way that we're targeting specific outcomes through kind of educational interventions, and those will also have a human support layer where needed. So if someone was working through a sleep course and felt that they needed a little bit more guidance on the topic, then they could get that through one of our sleep doctors who will be on the platform pretty soon.
So maybe on that, so the implicit assumption is that the Strove users are not in perfect health, but they're also not morbidly sick. It's not like they need urgent medical attention. That's implicitly true. But my question would be, let's say that I answer the self-assessment in such a way that it's consistent with severe depression, and my activity data is also consistent with I'm just not getting out of my bed. Is there a plan in the future to then facilitate me connecting to a psychiatrist, for instance, or is that beyond the scope of the platform?
No, absolutely. As you say, we're not trying to replace a doctor, but if we do suspect something, as you say, through one of our counselors, or then notifies us through a flag, we do have referral mechanisms in place so that people can get the help that they need. As you say, we certainly more targeted at people who are in reasonable health and are looking to kind of improve their health. But absolutely, we do have cases where we've needed to escalate care and refer people on. So we do have pathways in place for that.
Awesome. Thank you so much. I want to thank you for an incredibly insightful, helpful hour. I've learned a lot, and I'm sure this is true for everyone on this call. Thank you. And I look forward to following the Strove journey as I've been for many years, and from strength to strength.
Thanks, Wim. Yeah, I'll keep an eye on you on the leaderboard. Hey, keep it going there.
Yes.
Cool.
Thank you. Thanks, everyone. See you next month for another exciting episode.